Hello, everyone. My guest today is Jeff Broudy. He's the CEO of PCIHIPAA. The company changes lives by helping healthcare providers prevent catastrophic losses caused by regulatory non-compliance, data breaches, and human error. He led sales and marketing for Intuit's payment solutions division and has 20 plus years of experience in delivering payment processing and payment card industry compliance services. Jeff, you ready to take us to the top?
Yeah.
All right. This is like, I don't think anyone wakes up in the morning and goes, oh, I want to get into PCI compliance. And then they definitely don't wake up and go PCI compliance and healthcare. What the hell is wrong with you?
I just love helping people. And there's a big problem. When you go to your doctor, you go to your dentist, they're treating you really well, but they're not treating your information very well. And they just don't know the pitfalls. So we're helping protect doctors and dentists.
Okay, so who are you selling to? Me, the consumer, or the doctor or dentist?
No, we're selling to your doctor, your dentist, and anyone that you go to, private practices. Hopefully you don't go to a lot, but anyone that you go to, we're selling our services to.
Okay, so help me understand.
And the reason being, just real quickly, the reason being is that office manager, the pain point that we're solving, Nathan, is that usually a smaller practice doesn't have that layer of expertise, and we're helping the office manager, helping the doctor protect your patient data, so make sure it's private and secure.
So give me a sense of kind of how you're pricing. On average, what's a hospital or a provider paying per month or per year to use your technology?
We don't focus on enterprise or hospitals. It's doctors or dentists. We charge anywhere between $199 a month and $250 a month. That's not, with partner pricing and everything, it comes down a little bit, but that's our retail price.
Okay. So maybe a fair average might be like 150 or something.
Yeah, around 150, 160 on average when you factor in our partner pricing.
I want to talk more about distribution here first, but first let's put on a timeline. When did you launch?
2012 was when we concepted the idea of PCI HIPAA. First customer, 2013 or so.
Okay. And how many customers have you scaled to today?
3,200.
3,200. Okay. And so that's what I want to talk about. How have you done that? How did you get the first 100?
Two ways. The first 100 were through partners. We partnered with dental educational groups, dental associations, medical associations, IT providers, IT partners, other types of business associates with the practice. And then we launched a call center. So now we do outbound calling to practices. And we help them with their risk assessment. We do it for free. So we walk them through the required risk assessment so they can start to understand their vulnerabilities. And so we have a direct channel and a partner channel.
Yeah. So you basically call them up, Sam, hey, you're a shit show. Buy our software to solve your shit show, right?
We call them up and say, hey, it's required to take a HIPAA risk assessment under the HIPAA security rule. You may or may not have that on file. Let us help you do that. And in exchange, let us sit with the doctor for 30 minutes and talk about HIPAA compliance and data protection, because that's what we love to do.
So it's worth $150 a month to not get sued.
Exactly. Well, not get sued, not have a data breach, not have a ransomware attack, be able to recover from that. These kinds of things they work so hard building up their practices. One catastrophic incident and the whole thing can go away, unfortunately.
Jeff, you're good, man. I can feel, I'm not a dentist, so I can't buy, but if I was, I'm sold.
Our data is under attack. You can buy credit card numbers on the web right now by Googling buy a credit card number for $25 or $30. Your patient information is being sold on the black market on the dark web for about $1,000 a record. It's valuable to a hacker, and doctors. It's hard to protect. Even with a great IT company, it's hard to protect that.
What's funny about all this? I just assume, like, for me, maybe it's because I'm a millennial. Like, I just assume China has all this already, and they know where my cavities are, and they know what diseases I've had, and they know like when I had my last shots, and I just don't care that much until they actually use it to really hurt me personally some way. I just don't care.
Yeah, that's one point of view. That's not everyone's point of view.
I'd say I'm rare, by the way.
Yeah, and the other thing is that the government is caught up with it, and in the right way. I know HIPAA is a bad word to the medical industry, but they're really trying to do everything to keep the privacy and security of your information, and making sure that healthcare providers do that. And they just don't understand the law. They don't understand the safeguards they need to put in place. And it's the right intent, but it's so confusing. They're not sure about a lot of things, and that's where we come in and we help them. We try to mitigate their risk at the right price.
Is it sticky? What's churn over the past year?
Very, very sticky. We retain about 90% of our revenue every year.
Okay, so 10% revenue churn, and then what's expansion look like on the Poco? Do you have any expansion stuff yet or no?
Yeah, we're growing by about 40%.
No, not growth, not like total growth. The expansion on the cohort. So ignore new customer ads. The dentist that signed up.
We have. I don't want to get into some of because we have some competitors. I don't want to get into that, but we have some products in development. But currently, we do credit card processing because that's my background. We do credit card processing for our customers. We really do it because they're getting ripped off by their process, and we try to lower their rate to help compensate for our compliance fee, and that adds to our revenue base.
Okay, so I guess I'm just curious. Do you make up the 10% churn somehow, so your net revenue retention on that cohort from a year ago is 100% or north?
It's very close to that.
Okay.
I would say very close.
Fair enough. And then give me a weighted average, right? So how if a dentist signs up to use you for their payments, on average, what are they going to pay percentage to you versus what they currently pay?
Some of them pay, over 3%. They're going to pay less than 2.5% to us.
Okay. I mean, is that savings worth the switching cost?
Yes. In many cases it is. In many cases, we could actually save them enough money to cover that $199 fee. So net, they're not coming out of pocket anything, and they're getting a full compliance program, which also comes with $500,000 of cyber insurance. That's what really differentiates us. We're putting our money where our mouth is. We're not just providing a software tool, which we do. We're a compliance as a service company, but we also back them with cyber insurance because many practices don't have it, and every practice needs it.
Interesting. So past 12 months, total kind of GMV through your platform. Are we talking like hundreds of millions or billions or a million or what?
Through what? Say that again.
Total payments, total GMV kind of through your platform.
So our payments is about 20% of our revenue. Compliance is about 80% of our revenue. And we do over $200 million in processing revenue today.
Okay. I mean, that's annually. Jeff, sorry, that's annually.
That's processing volume to the practice. We make a little piece of that.
Yeah, you make a little piece. You make 2.5% or about $5 million on 200.
No. So the base cost is about 2% that everyone pays. We probably make about 50 basis points on that 200 million.
So, I see what you're saying, because of the, let's say you take 2.5% of that, you then still have to pay other fees, and then you're only keeping net on that 5% of the 200 million.
We're driving their prices down. We take a little piece for our service. The majority of our revenue comes from the recurring revenue of our compliance model.
Got it. Okay, so you're taking 0.05% of the 200,000. So it's about $1 million a year. That's revenue to you annually.
Yes.
I see. Okay, got it. All right, let's go back to your growth. So I thought I cut you off earlier and you were saying 40% year over year growth. That's on the whole business?
Yes.
Okay. And where's most of that growth come from? The SaaS play or the payments play?
Well, it's mostly the SaaS play.
Mostly the SaaS. Yeah, that makes sense. And you said 3,200 customers at $150 a month. That would put you at about $480,000 a month right now in revenue. Is that accurate?
Yeah, a little higher than that, but right around there.
And where were you a year ago, just so we can again back into growth rate?
Again, 40% annual growth rate year over year.
So about 320.
Yep.
That's good. Really good. I mean, so how do you get up to $1 million a month?
Our biggest barrier is this is white space. Compliance as a service in this niche is white space. They usually don't have a product, and they don't know they have a product. So our biggest barrier is the doctor's time and awareness. So we need to figure out better ways and more effective ways than just calling to build that awareness and get them to move. They're so busy, it's hard for them to find the time. And we need to help them find the time, build more awareness, and then grow our distribution channels. More of what we're doing today and doing it better and more efficiently.
I mean, are there more dental associations you can lock down though? I mean, how many of these partner agencies are there?
There's a lot of dental associations. There's medical associations. We have done a good job, but not a great job of penetrating them, and we just need to do more of it.
Okay. Now, have you done this all?
Every state has a dental association. Every state has a medical association.
I see. Do you pay them a kickback?
In some cases we do. In some cases we just do it and offer the best price they want. In some cases we support their association. It all depends on what they want and the opportunity.
So let me role play. Hey, Kentucky Dental Association, our retail price is $160 a month. If you let us come in and give a quick 30-minute talk at your next meeting, we'll give you access to your people for $140 a month if they sign up on the spot.
Right. Yeah, $199 a month. We'll give your whole association for $169 for the next 30 days.
Got it. Okay. Have you chosen to do this bootstrapped, or did you take dilution and raise?
We my founding partners and myself have bootstrapped it.
That's okay. So you guys self-funded.
Yep.
And what's team size today?
About 50.
Okay. So here's a magic question. I'm curious how aggressive you're being in terms of driving growth. Are you burning capital to drive growth, or you break even?
No, we're profitable.
You're okay, or even better, profitable. That's great. So how do you manage that, right? A lot of people say, hey, if you're bootstrapped and you want to build wealth, right, and be comfortable, pay yourself first. Build in a 10% margin at the top and then let all the other kind of flow through, spend 90% to grow the business. I mean, how do you think about how much do you let go to the bottom line versus reinvest?
I want to grow more, but I want to grow it smartly. So that's, looking for efficient and effective channels and growing it the right way is I grow our base by revenue, not raising money. Yeah. So we got it to a certain point. Now we're profitable, and now every single day we're pushing. Where can we spend that money? So I'm not sitting here. I am proud that we're profitable, but I know we need to spend more. I just want to do it in a way that keeps our cost per acquisition at the right level, and it's just a smart way to grow.
Yeah. Are you talking burning like 10 grand a month or like 100 grand a month?
Oh no, we're not burning anything.
Sorry, profit, 10 grand a month or 100 grand a month?
In the middle.
Okay, fair enough. And so talk about CAC. I mean, what's it cost you right now fully weighted to get a new $150 a month customer?
$1,000 to get a customer.
Healthy payback.
And it's about, net across all of our payments and everything, we make about $160. So we're in 5 to 6 months, which is great. I'll do that all day long. I came from the credit card processing industry. We go out, 12 to 18 months to get a client. So this is very comfortable for me, but it's trying to find better ways to do it and to grow it. That's the challenge.
How do those economics, $1,000 CAC, 7-month payback, you're spending $56 to get a new dollar of ARR. How does that compare to the economics you saw at Intuit?
It's probably at least 2x better.
Interesting.
In the payment space.
Yeah, and fair enough. Intuit was obviously had much larger revenues. They could afford a bit of a bigger cash gap, et cetera. You're doing it smarter, more bootstrapped, which is great.
I'm kind of conservative that way.
By the way, nothing wrong with that. I think that's great. All right, let's wrap up with the famous 5. Number 1, what's your favorite business book?
I just read Monetizing Innovation. So for all your listeners out there that are figuring out price, it's a great book to think about price as you're innovating.
Number 2, is there a CEO you're following or studying?
Yeah, River Cohen of Data Insure, an upcoming CEO and very good looking.
Data Insure?
Yeah, Data Insure.
Number 3, what's your favorite online tool for building your company?
An Intuit product was QuickBase, so we've used QuickBase and then also Basecamp.
QuickPay?
QuickBase.
QuickBase. Okay, number 4, how many hours of sleep do you get every night?
7 to 8.
7 to 8. I meant to ask you this earlier too. Let me circle back to it real quick. Planning to raise capital or no? Stay bootstrapped?
Stay bootstrapped, and unless a strategic partner can come in and help us go to the moon, then I'm willing to take some money.
And if that strategic partner comes along, let's say you're doing $6 million annual right now, all in, and they offer 3x, let's call it 18. I mean, do you think hard about an 18 all cash upfront deal?
No,
it's got to be higher than that.
Yeah.
Okay, like double that.
Yeah, we think we can do better than that. Yeah.
Interesting. Okay, very good. Last couple of questions here. What's your situation? Married, single, kiddos?
Married, 2 kids. Julian Reed.
Okay. And how old are you?
54.
54. Take us home here, Jeff. What do you wish your 20-year-old self knew?
My 20-year-old self, how to keep my hair.
All right, fair enough, guys. There you have it. PCIHIPAA helping dental folks and anyone really doing any kind of healthcare keep your data secure. They've got about $6 million in terms of run rate today across 3,200 customers. Their go-to-market strategy has been partnering up with dental associations and doing bulk deals. They're spending about call it $1,000 to get you $150 a month customer. So 7-month payback is obviously healthy. Churning about 10% of revenue annually, but expansion is about the same for net revenue retention, about 100%. 50 people on the team, profitable today, totally bootstrapped, which I love. Jeff, thanks for taking us to the top.
Thanks.